Hi, and once again, and welcome to Off the Cuffs. This is Bobby Kimbrough. Today we have with us Captain Motsinger. I want you to know that it's a privilege and an honor to have you here with the Forsyth County EMS. I want to thank you and welcome you to Off the Cuffs. We always start our conversations. We don't jump right into it. We like to know who's sitting across from us. Share some things about yourself. I heard that you were a veteran, so first of all, let me say thank you for your services. But I want to know who you are. Tell our listeners and our viewers who you are. Tell us about you and how long you've been with Forsyth County.
Sure, and thank you, Sheriff, for having me. I appreciate this. And as an EMS professional, we always like to be recognized. Everybody knows the red trucks and the sheriff's cars, but not a lot of people remember the ambulances. Yeah. So we thank you for letting us be part of this. I have been with Forsyth County EMS for 11 years now. Wow. I started off as a street paramedic and then worked my way up. I'm now the coordinator over the Mobile Integrated Healthcare or Community Paramedic program. We are a specialized group of paramedics that go out and we really address the needs of the community at large, of anywhere in this county, anyone who has a need. We try to focus our specific talents, as I like to call them, our medical knowledge, our experience on those people. Prior to my service here at EMS, I was a Navy corpsman. I was a medic with the Marine Corps for 5 years. Spent time at Parris Island, with the 2nd Marine Division. My wife is also a veteran. We met at Parris Island, so she's an ER nurse now. We have 2 kids. Just currently living the dream. Working hard, doing good things, trying to improve the community that we all live in.
Well, let me tell you that people remember the fire truck, and the police cars and sheriff's cars, but they need to remember the unsung hero, the paramedics that brought them back through from what they were going through. So I thank you on behalf of them. Well, today, we come to talk about the opioid crisis that has plagued not only this community, but it has plagued this country. Mm-hmm. The CDC says it's one of the largest and worst epidemics in the history of this country. And so a lot of people have a lot of opinions about this opioid epidemic. What are the numbers? What are we looking like? Is it really an epidemic? Do we really have a problem here in the county?
It is. It really is. To the best of my ability, we have watched the number of Narcan usage, and that's probably our best way at EMS to track the number of overdoses, because we can get an overdose call, and it may not really be an overdose call. It could just be an unconscious person. But when someone is administered Narcan by a paramedic, that is typically, there was an opioid, overdose, and there needed to be an intervention with Narcan to
So what
bring
is
them
that
back.
for our viewers? What is Narcan? Is it like candy or something? What is it?
Narcan is a medication, and what it does is at a cellular level, the opioid medication it binds to your cells, and when it does, eventually the overdose is because it relaxes your muscles, your diaphragm is a muscle, and you stop breathing. So what the Narcan does is it attaches to those cells and binds into those little bitty doors that opioids would normally attach to, and it blocks them from being able to actually attach to the cell. So it stops the absorption of the actual opioid. So therefore, they could take more if they wanted to right then, but they wouldn't be able to really feel that effect of it because Narcan's blocking the effect of that opioid. So in someone who's overdosed, when we give the Narcan, it blocks those opioid receptors on the cell, and it allows that person to start breathing again. Then the more, sometimes we may have to give them more. There's different ways to give it. You can give it up, someone's nose or in their vein or as a normal shot. But it's a great tool to have as far as reversing the effects of opioids.
Wow. So about how many times do you dispense Narcan?
I think it was around 1,800 incidents last year.
1,800?
So wow. That was a great deal more than we had in years past. I can actually, we tracked it for this year, and we are down to almost 1,200. So that's a huge benefit this year from last year. The difference. The main difference, I believe, in what's happening is the number of overdoses are not changing. I really feel like the number of times that people are having to call 911 for that overdose is what's changed. There's, different community organizations like harm reduction and a lot of different prescribers out there now that have made Narcan far more readily available to people. So instead of having to call that ambulance to reverse somebody with Narcan, they may just have it in their pocket or their purse or in their medicine cabinet to where they give it to that individual, and EMS is never called.
So what's driving this epidemic?
In my personal opinion, it's just the addictive nature of opiates. I mean, it truly is an addiction. It's a disease. And, I've watched the CT scans of when you give, a rat or another subject that has never had an opiate. You see these pleasure centers in the brain just light up. And then you wait and give it to the same one again, and it doesn't light up the same way. So your body is yearning for that feeling. You kind of chase that high.
Wow.
So, and I mean, it affects everyone, and in some people it affects differently. You could give me a normal pain medication, and I could be fine with it and handle it great. But you could give my brother the same pain medication, and he may just feel like, man, that's the greatest feeling in the world. I need to, chase that high. So, and the overprescription of stuff was a huge problem. And now that we're reining that back in, hopefully, in the medical community, there's a lot more restrictions from the DEA and other agencies on, the availability of a lot of these pain medications and the ability to prescribe them.
So what do you think is driving the epidemic?
I think, in all honesty, there's also an availability and a cheapness to heroin. So when you used to go out, people would go out and buy, pain medications like a Vicodin or a Percocet
Right.
or something like that off the street and pay $20, $30 a pill. You can go and get a bag of heroin for $10. So, and it does not, it really does not have a specific demographic that it looks at. I can tell you that I have run a 14-year-old that's overdosed on heroin, and I have also run a 76-year-old woman that's overdosed on heroin. And
so you're saying we got 14-year-olds using heroin?
Yes, sir.
In our county?
Yes, sir.
A 14-year-old?
Yes, sir.
A lot of people ask me the question, why is it an epidemic now? Do you think it's an epidemic because it's more suburban now? Or do you think it's an epidemic because more people are using it?
I think, in all honesty, that it did catch some eyes when it crept into, socioeconomic homes that were not used to having any kind of problems like that. When you have more affluent areas of the county that, typically weren't, this is not where drugs are. You think more of the inner city and things like that. That was what everybody was told, but this has no border. It goes from the inner city, and it goes to out in the county. It goes to every socioeconomic level, race, creed, color, sexual orientation. It does not care. It will kill them all the same.
You know what? Deaf is deaf. Deaf is deaf. And I appreciate you for saying that, because a lot of times I have conversations out in the community. People will come to me and say, in the 80s and the 70s when people were dying of heroin overdose, no one seemed to care.
Mm-hmm.
But just like you said, across America, it has reached out into suburbia. It has reached out into affluent. It has reached out into white communities, black communities. It has no respect of race, color, creed, sexual preference, orientation, just as you said. But the thing that amazes me about this is that we still, I don't think, get it. I don't think we understand that the numbers have been increasing for the last, 6, 7 years?
Mm-hmm.
They've been jumping every year. They've been increasing about 10,000 per year. I think last year somebody told me 72,000 this year across this country. This year the numbers are scheduled to be up somewhere toward the 90.
Mm-hmm.
We didn't lose that many U.S. soldiers in the Vietnam War. And I ask myself every day when I hear the call go out, overdose.
Mm-hmm.
To me, it stirs up an emotion that, can we beat this? What is it going to take for us to fight this epidemic?
I mean, I think in all honesty, we are making great strides.
Such as?
We're doing the right thing. As far as like getting the Narcan out there, reducing the stigma of addiction has been a massive thing. Before like you said, it may have been in that home where nobody wanted to know. You didn't want your neighbors to know that your son or daughter or your husband or wife had an addiction problem, but it was there.
Yeah.
A lot of times with social media and everything else, like I was saying before, it used to be you hid things. Now everything's out there for the world to see. And it's a lot harder to keep things hidden,
Wow.
and especially with addiction. There's resources out there. There's other people going through the exact same thing that you are, other family members, other community members. Somebody out there probably sitting next to you in the church pew knows exactly where you're at. But unless you open up and tell them, they don't know.
You said something that was interesting to me. You said stigma.
Mm-hmm.
Why do you think there's a stigma attached to it?
It used to be like if you were addicted to drugs, you were a bad person. That was just what came with it. You were out there selling drugs or committing crimes or breaking into vehicles and things like that. And we really, back in the 70s and 80s and even early 90s, we thought of, drugs as a criminal issue. We never talked about addiction. We talked about they were an addict, so they were, abusing drugs, and they were going out and doing all these nefarious things to obtain those drugs. But now we understand the science behind addiction. And we need to treat it as a public health issue just as much, if not more, than we do a criminal issue, and put those resources in people's hands. And there's been massive things like drug court in the county and mental health court to be able to really address these people's true needs at a baseline level. You just don't throw things against the wall and hope they stick. You really look at the people that you're trying to help and say, all right, where is their problems? What can we truly do to help them? And right now, just like instead of you call 911 when somebody overdoses and what hospital do you want to go to? And just take you to the hospital and leave it there. These paramedics that go out, they really talk to you and they say, what's driving your addiction? What are your substances? We can have the sheriff's officers and we can have the police step outside. Give us some time, give us some space. Because when somebody gets reversed with Narcan, they wake up and you have all these sheriffs around them and you have all the police department around them and fire and EMS. They're nervous and they want to get out of there as fast as possible. So they try to refuse any type of treatment. And technically we kind of have to let them. So, we remove those stimuli from that scene and we talk to that person on a very interpersonal level and say, look, we're here to help you.
That's good stuff.
We want to be able to if you want to get into treatment today, is that something that you would like? And if it is, let me make some phone calls for you. And we've been very successful into getting somebody from the scene of an overdose into inpatient treatment that day. And we will call around the state. We'll try to focus in the county. And that's the other thing is this county is resource rich when it comes to treatment options.
Say that again?
We're resource rich for treatment options.
I like that.
We have a lot of different things. Novant and Baptist both have programs, inpatient and outpatient. And they're two large medical centers. We also have a lot of other outpatient places. And as far as Old Vineyard and Daymark and Monarch and a lot of other programs around our county that we work with daily. And I know that phone number to call and that person to say, hey, look, do you guys have a bed available? I've got this person. I've done their assessment. Medically, they're stable. They just have an addiction issue. So they fit your program's needs. Would you be willing to take them today? And they'll say, either yes or no. And we'll take that person, give them a ride over there, and they go to treatment right then. So, and then it's up to them whether they stay and take the offer that we've given them or they don't. And if we see them again the next day, we're going to do the same thing.
What I really like about this is that you addressed a couple of things, the stigma behind it. How is it that a lot of times in situations we are very proud people. We don't want people to know what our dysfunction may be. True. So we hide them. So we kind of closet them, I would say. But when we remove the stigma from it and we remove a lot of things from it, then we begin to understand that it's all right to need help. Mm-hmm. And I think that's one of the things that we want to get across is that we have to remove the stigma from it because how I see you will determine how I treat you, how I respond to you. We have to respond to this in a way that we've never responded before. But when we talk about the opioid epidemic and we talk about the effects that it has on this system or our system, we talk about how it strains not only our emergency medical, but our court systems. I heard you talk about the court system, our criminal justice systems. But there's another system that was brought to my attention, the NICU unit.
Mm-hmm.
The number of babies that are born, already
that's horrible.
Addicted. And so I want you to talk about, to me, because a lot of people want to know, what can we do? How can we do this better than we're doing it? See, each one of us see it from a different perspective. I see it from having lost someone to the opioid epidemic. I also see it from the spouse. I also see it from a law enforcement perspective. I see it from so many different angles. But when I try to wrap my mind around it and see what is my role, how can we do this better? Mm-hmm. You said something about this is a rich environment with resources. How do we bring those resources to bear to where we're making a difference? Because as you said, I can get out here and try to do my part in terms of the enforcement end of it. You can do your part as an EMS professional. How do we bring all these resources to bear?
We talk. And I know that sounds very hands-off, but the more we talk about it, the more that we get these resources publicized, the more that people see that they work, and the more that the system is taxed, and we put pressure on the system, the better it's going to have to react. And to really look at it from a patient perspective, to see, let me talk to that person for where they're at. Let me not feel uncomfortable saying, are you addicted to drugs? Are you using opiates? What are you using? Is there any time that you've ever been clean? Is there any time that has ever worked for you? What worked for you? How did it work? What failed? And to have that conversation with somebody, just like, you and I are talking today, but to really, not be hesitant anymore, to say, hey, look, this is an issue I understand you have. How would you like for me to help you?
What I find out happens a lot sometimes, and it's disturbing. So each morning when I'm getting ready to come to work and begin my day about 5:30, I scan the news. I listen to the local news, national news. They talk about the various things that have taken place overnight, whether it's a homicide here, a shooting here. Mm-hmm. We have been inundated with so much of an overdose here, an opioid crisis, a homicide here, a shooting here, that we have become complacent, and we tend to expect the next unknown soul or the unknown overdose to take place. Mm-hmm. We've come to expect this in our everyday walk, to the point to where, because we become expectant of it, we're not applying all of our resources to try to prevent it.
True. And EMS has historically been a reactionary thing. Mm-hmm. Once you've hurt yourself, then you call 911.
Exactly.
That's kind of where my program's a little different. We're moving towards more of a preventive medicine thing. It's where if you overdose, then I'm going to call you the next day. If I wasn't able to get a community paramedic out to that scene of that overdose, then I'm going to call you the next day and say, hey, how are you? Is there anything we can help you with today? Basically, any time EMS is called to a scene and they obtain a refusal from that patient, whether they fell down and just needed help to their car or whatever it is, well, somebody on my team's going to call you and say, hey, look, what's going on? Our primary focus with this program started with high-frequency callers of 911. When we would notice that somebody had called 911 4, 5, 6 times in a month, and it would pop up on our radar, and we would go out and say, hey, what's going on? Is there anything we can do? Maybe it was just a little old lady that needed her blood pressure medication adjusted and didn't know how to contact that physician. Maybe she was falling in the shower and needed a grab bar. Or maybe it was somebody who had a persistent mental health issue that did not have treatment for it. Believe it or not, people fall through the cracks in this system constantly. One of our biggest success stories was a 40-year-old guy, and he's developmentally disabled, and it had never been diagnosed. His diagnosis was when he was in high school, and his treatment options were based on behavioral health issues, not developmentally disabled issues. So we called around and called around. He called 396 times to 911 in a year.
How many?
396 times.
Wow.
And the 6 months preceding our interventions with him, he's called 4.
That's almost every other day.
Mm-hmm. And he was actually hospitalized for 3 months of that time.
Wow.
So, but it was, he just didn't have the right resources. And nobody ever stopped to say, hey, what's going on? Why is this guy calling 911? And it was just, so we knew him. We knew it was a social security number. And we knew it was an easy call. So we pick him up and take him to the hospital. So now we're putting that on the hospital. And then he'd be discharged within 20 minutes because they knew him.
So how do you see this affecting? How has this affected you, the community, this overdose epidemic that we're experiencing? How is it affecting you? How is it affecting the community? You see it every day.
We do. The group of 8 of the 8 paramedics that work, for the mobile integrated health care, or the community paramedics, we try to run every overdose in this county, every single one.
Wow.
And if we can't get there, we usually get a referral for that person. So, it taxes us emotionally. We get very frustrated because maybe we do see the same person. I can tell you that I talked with a paramedic the other day, and we ran the guy 9 times. We Narcaned him at least 9 times, and that's not counting what he got out in the public. And then we kept begging him to let us help him, and he refused. And we kept showing up and kept giving him resources, and eventually we found him dead. And we knew him.
It was last week.
Yeah. We knew the guy. We become connected. You can't. If you care about anything as much as we care about people. That's our job.
Probably a young guy.
Yeah.
Yeah.
And we honestly and truly go out and it, like I said, race, creed, color, sexual orientation, it does not matter. We're here to help you, and we'll help you get treatment. But if
you know what I guess frustrates me is that these deaths could have been prevented.
Yeah, that's the most frustrating.
Yeah, these deaths could have been prevented. And my mind keeps saying that we can do better. Mm-hmm. We can prevent these.
We can.
And so it keeps me awake a lot of times at night trying to figure out, how do I do this better than what I did it the day before? You've heard me say many a times that this is not an EMS problem, not a police problem, not a social problem,
mm-hmm.
not a health problem, not a school problem. It's all of our problems. It's all hands on deck. And it has to be like that because we're losing too many lives every day, not just across this country, but in this county. We're losing
mm-hmm.
people. The effects of it is just devastating. And we've got to figure out a way to do it better than we're doing. And when you said, let's talk, that was the premise behind this podcast, is that bringing people to the table to talk.
Mm-hmm.
And you said something that was very interesting. By having these conversations, it moves us to a place of understanding, because there's some things that you're going to share with me that causes me to think about some things, and vice versa. Mm-hmm. There's some information that we're going to put out into the community that's going to cause the people to think about this differently, move the stigma from it, move the stereotype from it. Yes, I get it that this was an epidemic before we classified it as an epidemic. It was an epidemic when it was in the urban, in the city, when it was
mm-hmm.
in the black community. It was an epidemic when it was heroin and when it was being used, a cheap form. We get it. I understand that. But we can no longer hang our hats on what used to be and what is, but what was. But how do we address it right now? Because you said there are 14-year-olds that are overdosing off of heroin.
Yes,
in other words, we are having 14-year-olds that are beginning their life as addicts.
Mm-hmm. One of the best stories that I had, as far as when I first started doing this, when I transitioned into the role as a community paramedic, I had one call. I was driving through downtown and heard it come out. It said, you have a 36-week pregnant female. Chief complaint today was overdose on heroin. So I ran that call, and she refused. She was embarrassed. And I found out a lot of things from that one call. One, there was no resources for her. directly that she knew of. I didn't know those resources. She taught me because she told me, I don't want to be, the mother of an addicted child. I don't want to put my baby's life at risk, but I have this addiction and I can't stop and I don't know how and I don't want this. But if I'm told not to stop, so what is the right information?
Wow.
So I just took it upon myself to call people and ask them. I talked to physicians. I talked to OB, doctors. I talked to substance use treatment specialists. And together we all kind of came up with a plan for her. And then that led to me understanding addiction in pregnancy. And then also it led her to being able to keep her child and be a clean, successful mother once she gave birth. And then, I still see him every now and again, and just to see the little kid's eyes, he's happy, he's healthy, and it was because she taught me those things, and now I can go out and if I ever run across another mom who's addicted,
that's just one of them. That's just few and far between success stories, right? There's not a lot of success stories.
There's not, but if we talk and we have that conversation and we ask those questions, if we may not know the answers, but we know what the question is, so it's like, the next logical thing to do is, well, if I don't know this, who should I ask?
Right.
Let me go find that person. Let me push the boundaries of this a little bit. And, we're always hit with a bunch of, well, I'm not sure. That's not my job. Well, could you tell me whose job it is? And then we keep driving that system to be better. We keep pushing them to do the jobs that they say they're supposed to do. And I am in no way, shape, or form a policing agency, especially of medical practitioners, but I've had to learn service definitions. I've had to talk to administrators, CEOs of behavioral health providers and substance use treatment programs around this area and say, this is what you're saying you will do for the people in this community, and this is not what I'm getting back.
Wow.
So please, help me. I will sell your services all day long, but help them be what you say they're going to be.
So how is there something that you can do or tell to the people? How do they detect someone that is struggling with an opioid? How do you notice that a 14-year-old or 76-year-old is abusing opioids?
The biggest things to watch for are trust your gut. You know when something's not quite right.
Right.
If they start really, really withdrawing, not wanting to be social, not wanting to have that interaction, typically there is something going on. If you notice a very lethargic, slow attitude, inability to really conversate. Sometimes they go from really high, and then sometimes they go from really low. Those are typically things that are warning signs. And that addiction, especially with what's going on in the streets these days, is very dangerous because you can take a controlled pain medication like Percocet or anything else you could get prescribed in pill form, and that's very controlled. But you go and try to get that same effect from heroin, you don't know who made that. You don't know what's in it. You don't know how much fentanyl or carfentanil or anything else is contained in that. And that one injection could be your last, and it's not a good way to die.
I was sitting here listening to you, and my mind is racing. My mind is just running rampant, and as it always does. But one of the things that we talked about, and we are big on, is we talk about transparency. I've been a victim of the stigma that's attached to it. In other words, where I didn't want stigma or a certain type of stigma attached to me and my family. I sit here now and I can talk about it without crying now. I can talk about it without the emotions coming up. I still have them, but they're controllable emotions. Mm-hmm. Most people know my story of my spouse passing of an overdose. The autopsy report said methadone and toxicity. Mm-hmm. Word that I had never known. As a special agent with the DEA, I knew what methadone was, but methadone and toxicity for someone to die of that was new to me. I never knew what was happening, even in my own household. Mm-hmm. I was running here, doing this, working to where there are signs that as I sit in my quiet place in isolation, that when I look back, there are some things that, had I been more attentive, I would have seen. But even when my wife passed, one of the things that I did not want to talk about was how she died.
Mm-hmm.
I did not want to talk about it because of the stigma that's tied to drugs. It's that nastiness of drugs. It's that nastiness of addiction. And so I never talked about it, even to the point to where my children. And later on in life, things happen to where you're forced to talk about it. That's another story. And I found the more that I tell the story, the more that I talk to people about it, and you said it, that's what sparked it, talking, conversation, that where it has no respecter of race, color, creed, sexual orientation, or even economic status. My wife was an RN, had been a trauma nurse, worked in critical care, ICU. She had worked in Detroit at the Henry Ford, at Detroit receiving, overseas when we were overseas in Puerto Rico, one of the local hospitals here. She was a phenomenal woman, and I never knew what was going on until after the fact.
Mm-hmm.
I never knew until it happened. And when I look back at it, and I look back at what happened, when the doctor gave me, when the morticianer gave me the death certificate, and I saw that, I said, no, that can't be. Mm-hmm. I questioned that. And then I started going to the various drugstores in the neighborhood and seeing, was this prescribed to her for something? Was it something that she had that I didn't know about it? No avail. And then you just have to accept some things. But when I look back on it, I say to myself, how could I have done something? How could I have been, how could I have prevented this? And that's when you said something just now that I think that is key to the listeners, is that talking, communications. It's rare that we sit down with one another or loved ones or our children or our spouses and have a real conversation when we know something, like you sit here and say, what's going on, what's wrong? We can get through this together. Mm-hmm. That is one of the things that why we created some of the things. Never walk alone. This addiction, this thing, this path that you're on, you should never walk it alone. It's not something you can beat alone. Right. It's not something that you can deal with alone. It's something that, like I said, it's going to require a community effort. And that's one of the things that drives me, of all of my passions in this field. That is the one that drives me, because it affected me directly. Mm-hmm. It affected my children directly. And not a day goes by that when I hear an overdose call, it bothers me, it affects me. And so I thank you for what you do every day. I thank you and the first responders for responding. But I want the listeners and the viewers to know that this epidemic is an epidemic because of the impact that it has on our society. It's an epidemic not because they ran out of words to call it. It's an epidemic because of the seriousness of it. And we have got to approach it with a tenacity and a seriousness that we've never before approached it. We've got to approach it like it's a enemy, like it's a war, we've got to put all of our resources and efforts toward that, because every day we're losing good men and women. We're losing people, period. Mm-hmm. And my heart weakens and cracks when you talk about a 14-year-old child. That's what it is, a child using heroin. Yeah. Any type of opioid, any type of drugs. We've got to be more accountable. When we know something, we've got to say something. When we see something, we've got to speak. We've got to do something, because we're an advanced society. Mm-hmm. And as you say, we are a rich, resourceful community. And we've got to do something.
We do. And I think what you said really speaks to the unsung damage that's done, and it's not just the person who overdoses and passes away, but it's in the eyes of those that loved them, and it's in and we see it as first responders. We are there on the worst day of most of their lives, and just to see the damage that it spreads throughout the families and the communities and things like that, and really being present in your family's lives. And we do the absolute probably worst job of that than anybody, because, I can tell you personally, my relationships have suffered because, you bring that stress home with you. I can't tell you how many times, I've carried babies over their parents' dead bodies and things like that come home with you. And they cause stress, they cause things, but remember that your families are there. Be present in their lives and pay attention to what's going on. And the guilt that comes with it is a very normal guilt, and it's something that we all have to deal with. But I can tell you right now, I personally want to thank you for what you've done in this specific area, because being out there on the front lines, seeing the pain in a lot of people's eyes, and knowing that one of the reasons that this community is very resource rich is because its administration is understanding of the epidemic that is truly happening within it. And we are able to affect a lot of change when we have that understanding from upper level administration. So like I said, I wanted to thank you for that, and to really look at every individual within Forsyth County and even outside the borders. If you know someone, if you suspect someone, don't be afraid to have that conversation. And if you're wrong, you're wrong. It didn't cost you a thing to be wrong.
So true.
But just have that conversation. And, the number that you can always get a hold of is 911.
911.
And they know. Our telecommunicators know what we do. And once they send you our way, we'll come. We'll keep coming. We'll give you the help you want, or we'll exhaust every resource we have trying. And with community partners like we have around here, there's probably going to be a successful option for you. And we'll at least put it in your hand and say, here you go.
I just believe we can beat this. We can do better than we're doing. A lot of times when I'm out here on the streets, I try to respond to a lot of the overdose calls. I try to go see the families. I talk to the families. I try to go no matter where, whether it's out in the suburbs or whether it's out in a trailer, whatever it may be. I try to get there and show my support. When I think about that, I remember being out in Pofftown one night about 11 o'clock. The call came in of an overdose. The person was confirmed gone. It was a young man. And when I got there, his father and his brother had showed up to the house. And we stood out on the side of the road and we cried together. And he reminded me of something. He looked at me and he said, "Sheriff, please don't let another mother or father experience this." And every day I struggle with that because I know that I can't stop it. I know that I can't stop it. But I just wanted you to know that we've got to keep pushing the word out there. We've got to keep pushing collaboration. Collaboration. That's what changes the situation.
Exactly.
We've got to keep pushing out there that we've got to have all hands on deck. These resources that you talk about that are in our community, people got to bring them to the table.
Exactly.
They got to walk it like they talk it. They got to have skin in the game. They've got to do some things we hadn't done before. We've got to get out here and address the problem. We can't hide it away. We can't lock it away. We definitely can't lock it away. We can't. Some of the people that are in the facilities now, they're not criminal justice issues. They're addiction issues. They're mental health issues. And we've got to address them and meet them where they are and meet people where they are. And I get sometimes irritated and frustrated because I just believe that we got to do better and we're going to do better as it relates to this epidemic, because think about it. If it's a 14-year-old today, it could be a 13-year-old tomorrow.
Exactly.
tell a story about being at one of the middle schools where a child overdosed at a middle school.
Mm-hmm.
And this is serious. And if you think about it, a lot of people say, well, it hadn't affected me yet. Well, if they were really truthful about it, most people know someone, if it's not a family member, that has been affected by the overdose.
It's hit them somehow. I guarantee
Exactly.
it. I guarantee it. I mean, it's hit me. My brother, who's 12 years younger than I am, he graduated high school, and he had a core group of about 8 friends, 3 of which are dead now.
Wow.
I mean, that's a huge statistic. You know, I had one of my best friends graduated from high school. He passed away from an overdose.
Wow.
And we were close. I was in the military when that happened to him. Felt guilty, like, man, if I was there, I could have done something. But like I said, it touches everybody.
Yeah.
And one of the things you said that I really want to push is we do have these resources, but the phrase, well, that's how we've always done it.
Yeah.
It needs to die.
We can't.
You can't look at it like that. And we need to be innovative. We need to think outside the box. We need to push those envelopes, and we need to ask those questions. I mean, there's HIPAA laws and restrictions and things like that that don't allow me to talk to people. I developed a consent form that allows me to now talk to those people. I will find a way around it.
Yeah.
You know, don't try me. I'll find a way. I'll push. But that's what we have to all keep doing. It's just, well, they told me no. Well, ask why. Keep going. Don't settle for that.
That's the forward thinking that's got to take place, because how we've always done things, that may be all right, but we haven't always had this problem.
Exactly.
So how we've always done it is not applicable to what's going on now. It's not what we need now to survive the crisis that we're in.
You're exactly right.
Because what's happening now, we've never seen this before. We're living in a space that we've never seen before. Mm-hmm. And we've got to do some out-of-the-box thinking. We've got to bring some resource to the table. I want to say this, and then I'm going to wrap it up with you, is that we have to realize that, as I said, we can't lock it away, can't hide it. It's indirectly affecting us in many ways. It affects us in terms of the crime data, the statistics. It affects us in what we see in terms of mental health. It affects us in what we see in health issues, the NICU unit. It is affecting us in ways that we have not even imagined or even thought about yet. And so I want to thank you for what you do, you and your team, all the EMS and first responders. But I also want to thank you as a veteran who served this country and is serving this community now. We've got to have people who are willing to get in the game, whether it's they put sweat equity, whether they come in it with their resources. We've got to get in the game. This is the game of life. It's not a black thing. It's not a white thing. It's not a Republican thing. It's not a Democrat, no independent. It's a life thing.
Exactly.
And
right.
we've got to be in the business of saving lives and enhancing lives. I want to thank you, Captain, for being here. I appreciate what you do. Keep doing what you're doing, because a life is a life, and a life that matters.
Exactly.
I appreciate you, my brother, for
Thanks,
being
Sheriff.
here. Thank you very much.